guys. I'm here with Dr. Josh Livingston as we discuss topics about depression. So a lot of times right now, especially with the pandemic, people are coping with these kinds of things, and Dr. Livingston has been so kind as to offer his advice and his expertise in these subjects, as his clinic specializes in depression and hormone therapy and treatments that are alternative in medicine. So we want to give those to you guys, for those of you who may be at home that are struggling with some of these harder feelings. Dr. Livingston, why don't you tell us about depression and ketamine treatments?
Sure. Right now, with everything that people are under a lot of pressure, we're confused as to what's going on. We're isolated. We're alone. Many people are jobless. Money problems. There's a lot going on that's really causing a big increase in both depression as well as anxiety. Unfortunately, there's very few good options for treatment, and the traditional antidepressants tend to not be very effective. And if they are, it often takes 4 to 6 weeks. We're seeing extremely high levels of overdose, drug addiction, and drug abuse. Unfortunately, recently there have been 2 murder-suicides in Sand Springs in the last 10 days alone. It shows just how intense.
Were those drug-related, I'm assuming?
We don't know exactly what was going on there, but certainly you would assume there's a significant amount of depression if someone's going to get to that point where they break, right? And what we're seeing too commonly is that people don't seek out help. They don't know where to go or what to do. And again, the medicines that are traditional tend to be not very effective, right? So antidepressants tend to be about 40% effective in patients. Sadly, placebo, meaning the patients who take nothing in the same study group, get better about 30% of the time.
Wow.
So it really shows there's a lot that needs to be done to improve outcomes with depression, right? So one of the treatments that's been really very interesting and very effective over the last 5 to 6 years in our area, probably the last 10 or so, is ketamine. It is an older surgical anesthetic drug. It is also a party drug, supposedly, a special K. People ask, isn't that a horse tranquilizer? It's all of it.
Oh, okay.
In surgery, we use very high doses to put people completely out. What they discovered is those people who got that medicine as they came out of surgery, many had an elevated mood. They did not explain why, or so they tried to figure it out. And what they discovered was that a much lower, safer dose used in the office setting can be very effective in a short period of time to relieve depression symptoms, even suicidal depression symptoms.
Wow.
Often as high as 75 to 90% effective, much, much higher than your traditional antidepressants, and essentially immediately effective. And weekly treatments are often required, but often a single dose, a single treatment can make a dramatic difference for somebody.
That's great.
It is. It was considered the biggest breakthrough in psychiatry since basically the SSRIs or Prozac. So it is something that really is available, it's accessible. At the office here, we make it affordable. It's just that people need to know about it. And they don't really know. And again, since it's known as a party drug, they think, well, gosh, isn't this going to be something that I'm going to go in there and just have a fun time? And it really isn't. It can be very effective. And currently in Oklahoma, at least, it is the only legal hallucinogen. Most hallucinogens are being studied currently. Even in Oregon, they recently legalized medicinal mushrooms for depression. That is not here yet. If it gets here, great. But for those who are suffering now, ketamine is available currently. So it really allows patients another option. Whether they're on medicine or they aren't, they can still get the treatment. So it is something that can really make a big difference for people.
So ketamine is one of those drugs, you guys, that may have stereotypes against it. But as we delve into depression, as we start looking into other alternatives, we know what doesn't work. And a lot of times, I know I've had friends in previous histories that have been on antidepressants, and we've talked about some of those drugs. You guys, I'm generally not familiar with these things, but Prozac, I've heard, Xanax, I've heard, Valium, I've heard, and I've also heard that they don't really work for everybody I know that is on them. They don't have the positive benefits. In fact, they either keep taking them and the panic attacks generally get worse, and then when they try to quit taking them, they go through withdrawals on some of them, especially with Xanax. That can be a very, very hard drug to detox from, correct?
Absolutely, right. And what isn't...
Ketamine, they wouldn't, right?
Absolutely not. There's no addictive properties to ketamine physiologically, and since it's given in the office, there's no real concern about dependence development, right? I mean, I guess someone off the street, potentially, but even that, the actual physiologic dependence, there is no withdrawal if they stop.
Ketamine isn't something that's readily available on the street, so it's not like if you have a teen or somebody suffering from depression, they could just replace this and go get it somewhere else and do their own IV. Like, you don't have to worry about that kind of side effects, whereas if they already have an abusive history with substances, then putting them on more mood stabilizing drugs may not be a great alternative. I come from the background of Ayurvedic yoga meditation, and the doctor really believes in this as well. So some of the things that we talk about insofar as ketamine treatments afterwards are reprogramming the brain with these positive thoughts, correct?
Absolutely. Some of the things that are done in Western medicine are focused solely on the body, not the mind-body connection. And we're hoping for a pill to make us better without any effort on our own part. And ketamine can get you sort of started. It can get you motivated, get you feeling better, but it won't be everything. There's a lot that the patient has to do on their own to continue to improve, to make those adjustments in a day-to-day basis, right? We can start, we can get them off the couch, we can get them moving again, but that's what they're going to have to continue after the treatments.
Absolutely. That's great, Josh. Thank you so much, Dr. Livingston. And you guys, for those of you who are struggling with depression and you need to see a doctor, please feel free to call our clinic. You can follow us on Instagram. Every week we're going to do more updates on health information as it pertains to you. So if you have feedback or if you have things that you're working through, please let us know and we'd love to help you. You guys take care and we'll talk to you next time.